Assalamu alaikum. So last time we discussed diabetic retinopathy in detail. We discussed the early treatment of diabetic retinopathy classification. We also discussed hypertensive retinopathy and the Keith, Wagner, and Parker classification for hypertensive retinopathy. Now, last time we discussed three classifications of diabetic retinopathy, three grades in the early treatment of diabetic retinopathy classification. We discussed non-proliferative, we discussed proliferative diabetic retinopathy, and we also discussed advanced diabetic eye disease. There is one grade still remaining, and we will discuss that first today before moving on to our next topic, and that is this picture I've shown you. What is wrong in this fundoscopy? Retinal examination.
Macular पे exudates हैं.
That's good. Exudates at the macula. What else?
Periphery is like bluish gray.
Bluish gray. I'm not seeing any blue. But yes, the periphery is dark. All right. Something else, something around the disc. Hemorrhages. Yes, hemorrhages. You can see blocked hemorrhages. What else? Focus on the disc. Focus on the vessels which are going inferiorly from the disc.
Pale. Obliterate हुई हुई है.
Obliterate, pale. ठीक है. None of you guys are close.
Engorged.
क्या बोला है किसी ने?
Engorged.
Engorged. All right. What else? I'm looking for one specific answer. Aneurysms are difficult to visualize, but yes, they can be present over here, over here, over here. We can better see aneurysms using an investigation, which we have discussed already. And there's something grossly wrong around these vessels, which is not around this vessel. Okay? Look at the superior vessels, the one over here, and look at this vessel.
Whitish appearance.
Whitish appearance. So what are these white spots called?
Silver eye reflex.
No.
Calcium deposit.
Calcium deposits. It starts with C, but it's not calcium deposit.
Cotton wool spots.
Cotton wool spots, right? Yes, these are very mild but significant cotton wool spots. Okay, we saw cotton wool spots in our last slides as well in our previous discussions over here. In this slide, in this picture of proliferative diabetic retinopathy, they are very clear, these cotton wool spots. Okay? They are very clear. Our current slide, in this current picture, they are not as prominent, but you can see when you compare the superior vessels and the inferior vessels, that the inferior vessels have some cotton wool spots now. So yes, these are more or less on the findings. Now we will focus on one main finding, which is hard exudates around the macula. There are also cotton wool spots. There are microhemorrhages, microaneurysms, plot hemorrhages, and all of that. There is no proliferation at the moment. We can see that there is no proliferation at the disc and elsewhere. A general brief examination does not give us any proliferation. So this is non-proliferative diabetic retinopathy, but there is something going on as well. The macula is involved. So when the macula is involved, we call this, what do we call this?
Macular.
Maculopathy, yes, diabetic maculopathy. So this is one of the grades of early treatment of diabetic retinopathy classification. But when this grade is discussed, there are two terms discussed specifically. One, they are called clinically significant macular edema, and the other is non-clinically significant macular edema. we will discuss clinically significant macular edema. What is clinically significant macular edema? CSME. क्या होता है? किसी ने क्लासिफिकेशन में पढ़ा है ये? What is CSME?
पढ़ा था, मतलब उसकी स्पेसिफिक रेंजेस थी कि इतने मिलीमीटर थिक।
बिल्कुल,
500 माइक्रोन तक जो होती है।
बिल्कुल, exactly. That is what you have to remember when we are discussing clinically significant macular edema. Clinically significant macular edema is, नाम में तो macular edema है, but it is either the presence of edema or presence of hard exudates within 500 microns or the span of 500 microns around the fovea. ठीक है? Edema or hard exudates present at or within 500 microns of the center of the macula. So in this slide, we can see that the center of the macula is around about here, at the pointer is, and there are hard exudates within 500 microns. अब मुझे कैसे पता है कि 500 microns के अंदर है? Does anybody have a rough idea? How can I say this is within 500 microns?
उसको ऑप्टिक डिस्क से कंपेयर करते हैं।
बिल्कुल, ऑप्टिक डिस्क एरिया के साथ कंपेयर करते हैं, राइट? तो an area of the optic disc is called a disc diameter. वहाँ पढ़ेंगे it's around 1.500 micrometers, 1.5 micrometers or something of the sort. So as a comparison to the disc, so you can see that it's significantly around in the area of the macula. These are hard exudates. So this is our this constitutes clinically significant macular edema in this slide. ठीक है, तो our scenario is more or less the same. 60-year-old patient presents you with decreased vision in both his eyes, type 2 diabetic for the last 20 years. Investigations are the same. We did non-specific investigations at first, including his glucose profile and etc. We did his visual acuity. We found out it was subnormal, 6/20 हमने discuss कर ली थी. After doing his fundoscopic examination, we see that there are hard exudates in 500 micrometer. This is micrometer. From the macula. What else do you think we need to do in this patient?
OCT.
OCT. All right. I don't have OCT at the moment of this clinically significant macular edema because OCT is used. However, we classify clinically significant macular edema, we classify it according to another investigation, and we will focus on that. Yes, OCT we will do, and OCT will show us retinal edema and retinal edema. Yes, it will mainly show us retinal edema. What is the other class investigation we need to do? FFA. Fundus fluorescein angiography. Fundus fluorescein angiography shows us the condition of the vasculature in terms of perfusion and how blood is flowing throughout the retina. So let us say we have 3 different examinations of macula and we have 3 FFAs. We'll start with this one. It's not such a high resolution picture, but it serves the purpose. What is wrong with this fundus examination?
Atrophy.
You cannot tell atrophy at this moment, but state the obvious. What is obvious?
जो yellow
Yellow deposits.
Yellow exudates, right? The yellow exudates, these are pretty obvious in this picture. Now, when we do a fundus fluorescein angiography of this picture, this is what we see. Okay, you can tell, you guys are pretty smart. You can tell that there are focal exudates around here, around here, around here. Some of them might be dot plot hemorrhages. Yes, you are right. But regarding this focal exudation, which we saw on the fundus examination, what is the relevant finding in this fluorescein angiography?
Hyperfluorescence है जहाँ पे exudates हैं.
बिल्कुल. You can see that corresponding to this exudation, there is hyperfluorescence in this area. When you look at this hyperfluorescence from afar, you can see that this hyperfluorescence is confined to this area only. It's localized. Okay, it's not generalized in the whole macular area or the fovea area or even the retina. It's a generalized, not generalized, it's a focal area. So on this fundus examination and on this fundus fluorescein angiography investigation, we see that there is focal hyperfluorescence. Hyperfluorescence means that there is increase or decrease of exudation. क्या होती है? Increase होगी, decrease होगी?
Increase.
Increase होगी ना, right? The increase है. So this is our कौन सी क्लास बनती है फिर ये, अगर किसी ने क्लासिफिकेशन खोली हुई है क्लिनिकली सिग्निफिकेंट मैकुलर एडिमा की? This is focal exudative maculopathy. Yes, this is focal exudative maculopathy. We can have microaneurysm, hard hemorrhages, etc. But the important thing is that we have found hard exudates within 500 microns of the macula, and in these classically sarcinate pattern में भी एक तो है ये. And secondly, on FFA we see that there is focalized exudation. This is focal exudative maculopathy. Okay. So moving on to our next type. This is our retinal examination, fundoscopic examination, and this is the fundus fluorescein angiography. You guys already know, you can see the hemorrhages. You can see the hard exudates. You can see some of the hard exudates over here even. There's a lot wrong with this picture. When you perform the fundus fluorescein angiography, this is what you see.
Diffuse.
Diffused what?
Retinopathy.
Diffused hyperfluorescence. That is the term you will use. You can see that hyperfluorescence is over here. It's 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 diffuse. It's present all around, this hyperfluorescence. And this hyperfluorescence, it indicates exudation, right? And we can see, and we compare with the normal fundus picture, and this, we can see that this is the optic disc, and this is most probably the area of the macula. And this exudation is around, is impeding, is present within 500 microns, micrometers of the macula. So this is clinically significant macular edema. Which subtype?
Diffuse maculopathy.
Diffuse exudative maculopathy. Yes, this is diffuse exudative maculopathy, our second type of maculopathy. Okay. Why this is diffuse? Because there is diffuse exudation all around. Pura retina, or specifically macula ke ird-gird, there are diffuse patches of exudation. Unlike this picture, जहाँ पे सिर्फ एक patch था. This is diffuse, focal exudative. This is diffuse exudative. Coming on to our third type. Okay. You guys already know this is a right-sided fundus, clot hemorrhages. It's appearing overall reddish. There are some hard exudates over here as well. It's hard exudates around the macula. When you perform the fundus fluorescein angiography of this patient, what do you see?
Again, hyperfluorescence.
But not on the macula.
Not on the macula.
Not on the macula.
So yes, there is hyperfluorescence. Some over here, some over here. You can also see these tiny dots, these microaneurysms.
Okay.
These microaneurysms, of which are classical in diabetic retinopathy. But yes, we can say that macular area is more or less spared. And why is this area black?
Less perfusion.
Avascular.
Avascular, yes. Hyperfluorescence कहाँ पे होगी जहाँ पे जो fluorescein stain है, जो pigment है, which is inside the vessels, it leaks out, right? So the macula we know is avascular, and it is avascular. That is why it appears as black. Now, one thing I want to quickly show. Normal FFA. Yes, this is the normal FFA, fundus fluorescein angiography. Look at this macula. Okay, closely look at the macula. Okay, this is the macula over here. Okay, look at this distribution at the uniformity of the zone. The blackness, hyperfluorescence, and look at its distribution. And now again, look at this fundus fluorescein. Do you think something is different from the normal picture about the macula?
Irregular?
Irregularity. Yes, where is the irregularity?
Margins.
Margins, right? Okay. So we can see that there's an avascular zone. This is the macula, and avascular zone is going upwards towards it, right? And even though we saw small hard exudates around the macula, i.e., meaning that this is clinically significant macular edema, CSME. However, when we did the fundus fluorescein angiography, we saw that the macula is relatively hyperperfused, or it's looking normal. But the avascular zone is somewhat extending superiorly. Okay? So, यानी कि there are hard exudates within 500 microns of the macula. ये हमें नजर आ रहे हैं इसमें. These are hard exudates. ये. So this constitutes clinically significant macular edema. लेकिन जब हमने fundus fluorescein angiography की, we saw that the macula is relatively normal and spared, और avascular zone थोड़ी सी ऊपर की तरफ बढ़ रही है. So this type of clinically significant macular edema, it's called, what is it called?
Ischemic
maculopathy, right? This is ischemic maculopathy. Again, this is clinically significant macular edema. Why? Because there are hard exudates within 500 microns of the fovea of the macula. And we can see that the normal foveal avascular zone is present, but there is an increase in the avascular zone superiorly. So this is ischemic maculopathy. ठीक है? Foveal avascular zone होती है normally, जहाँ पे हमने normal FFA में देखा कि there are no vessels in that area. It's hypofluorescent. It's blackish in appearance. But in this FFA, that avascular zone is extended somewhat superiorly. This is ischemic maculopathy. And there is a last final type, which is a mixed type, meaning that you can see some avascular zones as well. You can see exudation as well. These are the three types of clinically significant macular edema, which you have to remember. Okay? And how we differentiate on these three types, these three classifications using a fundus fluorescein angiography. The first is focal, and it's exudative. The second is exudative, but it's not focal, it's diffused all around the macula and as well as the retina. The third is neither exudative nor diffused. It is ischemic because we can see that there is a foveal avascular zone resembling the normal avascular zone. However, it's extended superiorly. This is ischemic maculopathy. So these are the three types of diabetic maculopathy which you have to remember. And these are the three subtypes of clinically significant macular edema. Clinically significant meaning that it is the edema or the exudates, they are present within or at 500 microns of the macula or the fovea. Okay. This was the third type which we left last time when we discussed diabetic retinopathy. So this finishes our diabetic retinopathy. The next topic we have to do, I will not tell you the topic, I will present to you the case. This is the case. Okay. Briefly read the case and let's discuss the symptoms present in this case.
Age.
Age. The age is important.
Already hypertensive and diagnosed with temporal arteritis.
Hypertensive and having temporal arteritis. अच्छा मैं अभी सबको बता दूं ये दो चीजें मैंने साथ लिखी हैं, hypertension and temporal arteritis. This does not mean that both have to be present in this case. ठीक है, either of them can be present. ठीक है, either of them. Patient can be a hypertensive or even he can have temporal arteritis. Both do not. ये जरूरी नहीं है कि दोनों साथ साथ मौजूद हों और दोनों साथ होंगी तो डिजीज होगा. ठीक है. What else?
Acute loss of vision in one eye.
Unilateral vision loss past couple of hours. Yes, unilateral and acute loss.
Sudden.
क्या चीज किसी ने कुछ बोला था दिमाग में?
Sudden loss.
Sudden loss. Yes, sudden loss of vision. Sudden acute over the past couple of hours. Okay, this is your case. Before moving on to our management and workup, I want a list of differential diagnosis. क्या differential diagnosis हो सकते हैं? Unilateral, sudden और acute vision loss के.
Hypertensive retinopathy.
Hypertensive retinopathy, Dr. साहिबा ने कहा. Anyone else? रेटिना से बाहर निकल जाओ. It includes the whole eye.
Acute glaucoma.
Acute congestive glaucoma. That is excellent. Acute congestive glaucoma presents with sudden loss of vision, unilateral loss of vision. What else?
Optic neuritis.
Optic neuritis. What? Optic neuritis. ठीक है. क्या हो रहा है? एक सेकंड. With this. Optic neuritis. Anyone else? Anything else? Wild guesses. Anything? ट्रॉमा हो सकता है इस बंदे को. किसी ने आंख पे कुछ मार दिया हो और खेलते हुए आंख पे कुछ लग गया हो. ठीक है. What else? और क्या हम सस्पेक्ट कर सकते हैं सिर्फ इतना सुनने पे?
Occlusion.
Occlusion of what?
Artery or vein.
Artery or vein. That is an excellent. On an excellent ED. CRAO/PRV. Right? Sorry. CRVO. Retinal or vein occlusion artery. That is good. What else?
Hemorrhage.
Hemorrhage. A vitreous hemorrhage. That is good. There can be unilateral loss over the couple of hours. ताज़ा vitreous hemorrhage हुआ है. और क्या हो सकता है?
Retinal detachment.
Retinal detachment. बिल्कुल retinal detachment में हो सकता है. What else? ठीक है, चलो इतने काफी हैं अभी के लिए. So yes, these are some of the differentials which you have to remember when we are discussing unilateral vision loss. Hypertensive retinopathy, the first जो हमने list में लिखा, we discussed last time that hypertensive retinopathy develops over a large period of time, long time. ठीक है, these are long-standing these are retinopathies. और hypertensive retinopathy की हमने कोई ऐसी complication नहीं पढ़ी थी जिसमें sudden vision loss हो. We discussed in diabetic retinopathy that there can be a vitreous hemorrhage and other such things. We did not discuss in hypertensive retinopathy. Hypertensive retinopathy, number one, it will be bilateral because it affects both the eyes equally. hypertensive retinopathy अगर हो रही है उसके साथ कुछ हो सकता है, which we'll discuss in this case. But hypertensive retinopathy, whenever this will be a diagnosis, remember that the vision loss should be bilateral and it should not be sudden. It should be over years. It should be gradual. It should be so that is why this is not hypertensive retinopathy. Insidious. The term is insidious. The vision loss will be insidious, slowly creeping. Optic neuritis, yes, it can present with sudden vision loss, but the vision loss is gradual. Yes, we can include this in our diagnosis. So roughly, these are all the diagnoses which we will have to keep in mind. So how will you work up this patient?
Visual acuity.
Visual acuity.
Visual acuity. So when first we started with visual acuity, his visual acuity, unilateral vision loss. Let's say his right eye is affected. And right eye, the visual acuity is hand movement. That's impossible. Left is relatively normal. Right is counting hand movement. आगे क्या करना चाहिए? Fundoscopy. Fundoscopy से पहले some general slit lamp examination देख लेते हैं because it includes examination of the anterior chamber as well as the posterior chamber. Anterior chamber is normal. Anterior chamber is unremarkable. जब हम posterior की बात करते हैं the fundus की, when we examine the fundus, this is what we see. Because we are seeing this for the second time in 3D data.
Cherry red spot or
there's a cherry red spot in the center. What else?
The whole retina is pale.
The whole retina is pale. Retina is pale. Diffuse paleness of the retina. The whole retina is pale. और क्या है इसमें? नॉर्मल पिक्चर साथ रखनी पड़ेगी दोबारा से. At the normal picture. This is normal. Okay. Yes, everyone saw that there's a cherry red spot. Everyone saw that this is the normal perfused retina. And this retina is extremely pale. और क्या है इसमें?
Vessels are constricted.
Vessels are attenuated or constricted. Yes. This vessel is small, attenuated, constricted. This vessel is small. So we can see generally all of the vessels that are coming from the disc, they are attenuated. और कुछ है इसमें?
Macular distinct नहीं है.
क्या बोला? दोबारा बोला, मुझे सुनाई नहीं दिया.
Macula इतना distinct नहीं है.
Macular distinct नहीं है. ठीक है. That is finding क्योंकि macula इसमें relatively dark नजर आता है हमें, not as bright. Macula is especially appearing whitish. दरमियान में cherry red spot है. और क्या नजर आ रहा है इसमें?
ऑप्टिक डिस्क के टाइम साइड पे कुछ येलोइश स्पॉट्स नजर आ रहे हैं.
Yes, optic disc के side पे we can see these cotton wool type spots, right?
Cotton wool spots.
Yeah, cotton wool spots हो सकते हैं. That. So 6 minutes है. Based on these findings, जो मैं आप मुझे बताएंगे लिखने में, ठीक है? Fundoscopy has yielded us. क्या fundoscopy में मिला है?
Cherry red spot.
Generally pale retina. Cherry red spot in the center of the macula. ठीक है? Center of the macula. और हमें क्या मिला था?
Attenuated arteries and veins.
Attenuated / constricted vessels. Constricted vessels, attenuated / constricted vessels all around. some cotton wool spots, right? Spots around the disc. आगे आपको क्या एग्जाम इन्वेस्टिगेशन करने की जरूरत है?
FFA.
ठीक है, FFA. अच्छा, अब मैं एक आपको चीज बता दूं. There is one thing called FFA, fundus fluorescein angiography. Fundus fluorescein angiography जो हम कहते हैं, उसमें as you know we inject fluorescein in the vessels और फिर हम उसकी टाइमिंग मेजर करते हैं कि डिफरेंट फेजेस हैं कि एट द स्टार्ट जब fluorescein आना शुरू हुई है वेसल के अंदर तब क्या स्टेज है, मिडिल में क्या स्टेज है, एंड पे क्या स्टेज है. It effectively gives us an idea about the arteries, the capillaries and the veins. Fluorescein fundus angiography से ज़्यादा एक इन्वेस्टिगेशन कॉमन है जो यूज होती है. इट्स कॉल्ड एन OCT FFA. OCT FFA क्या होती है? इट्स बेसिकली FFA fundus fluorescein angiography जो नॉर्मल हमें नजर आएगी, बट इट्स डन यूजिंग एन OCT, optical coherence topography machine के जरिए कहते हैं, and it gives us more or less the same picture. It's less time consuming, it's quicker, or it's safer than FFA. तो OCT FFA is usually used. मैं आपको बताना चाह रहा था कि OCT FFA भी आप एक साथ रखें तो it's itself an investigation. And we perform the OCT of this patient, sorry, FFA of this patient. This is what we see. नॉर्मल FFA दिखाने की जरूरत है इसमें?
No.
क्या समझ आ रही है इस FFA में?
चेरी रेड स्पॉट है.
चेरी रेड स्पॉट है, मतलब मुझे तो नजर नहीं आ रहा. आई थिंक इट्स ब्लैक एंड ग्रे. ये तो रेड नहीं लग रहा. ठीक है, तो वो चेरी रेड स्पॉट जो हमें उधर नजर आ रहा था, वी कैन सी दिस ओवर हियर. ठीक है, देयर इज एन एरिया ऑफ hyperfluorescence. It shows some perfusion, but overall the retina is hypofluorescent compared to a normal, meaning that it is underperfused. The whole retina is underperfused. ठीक है,
हाइपरफ्लोरेसेंट लग रहा है ये तो.
हाइपरफ्लोरेसेंट लग रहा है आपको, यानी कि नॉर्मल साथ रखना पड़ेगा. दिस इज द नॉर्मल. इसको हम इसके साथ, this is the left eye, this is the right eye. अब गौर से देखो.
तो हाइपोफ्लोरेसेंट का तो डार्क नहीं होना चाहिए.
हाइपोफ्लोरेसेंट डार्क, आई थिंक दिस इज अ रिवर्स एंड फिर रिवर्स है इसमें, इस पिक्चर में, बिकॉज कंपेयर टू द वेसल्स में प्लाट है ना इस वक्त. आई थिंक दिस इज एन OCT FFA जो इन्होंने किया हुआ है. तो यू राइट, आपने अच्छा पिक किया कि द कलर इज ऑपोजिट इन दिस पिक्चर्स इनसाइड. This is what should be white here is black over here, and what should be black over here is white over here. But compared to this, I think this is an OCT FFA. That is why it's different. मैंने इतना गौर नहीं किया था इस पे. अच्छा, but even if you compare these two, the distribution, normal, do you see such a spot present? It is not present.
No.
The normal vasculature, it contains the dye, which we are seeing as the straight dye. In these, we can say that is not present as much. Vessels are shrunken. Yes, there is an inversion of the black and white colors, but if we compare them otherwise, then this is not as similar to that. So based on this FFA and this clinical examination, fundus examination, what is your diagnosis?
Central retinal artery occlusion.
Central retinal artery occlusion. Okay. So this is a case of central retinal artery occlusion. Case will typically present as an hypertensive or a patient who has थोड़ी सी pathophysiology आ जाती है. Case will be a patient who will have a predisposing factor such as hypertension, temporal arteritis, or Burgess disease. Burgess disease क्या होते हैं? You would study in patho later on in the year. What is pathophysiology briefly before this session ends and we start the next one?
Occlusion of the central retinal artery due to a thrombus.
ठीक है, occlusion due to a thrombus. किसी ने थ्रोम्बस कहा. What else do you think? Does anybody else have any idea?
टेम्पोरल आर्टरी इफेक्ट हो रही है.
टेम्पोरल आर्टरी इफेक्ट हो रही है. टेम्पोरल आर्टरी के इफेक्ट होने से क्या हो रहा है?
इन्फ्लेमेशन हो रही है, इसकी वजह से वेजोस्पैज्म होगा.
Vasospasm होगा, occlusion होगी. That is good. That is what happens in temporal arteritis. But जो thrombus वाली बात की थी, occlusion is not due to a thrombus.